Good afternoon. Today I would like to inform you all about HIV, immune deficiency virus, and AIDS, acquired immune deficiency syndrome. Data show that about 35% of AIDS cases have been in the age gathering of 20 to 29 years old. Many of you already know that AIDS has a long period between the infection and the virus. The appearance of symptoms may not show until years later, meaning that some of these people between the ages of 20 and 29 probably contracted the virus when they were teenagers. Being that majority of us in this room are in the age range or near, my objective today is to inform you of how the infection is contracted, the symptoms of the virus, and most importantly, the best way to take more precaution in preventing this fatal virus. AIDS is preceded by HIV infection. HIV can only be transmitted 3 different ways. The first way to contract HIV is through sexual contact. This is the most common way HIV is contracted. It can be passed when an infected person has vaginal or anal intercourse with another. The second way this deadly virus is transmitted is through the exchange of blood. This method of transmission is now almost entirely limited to people who inject drugs or share needles. This type of contact between an infected person and someone else is the second most common way this virus is passed. HIV can also be contracted through blood transfusions. Now, blood transfusions are far safer now than what they were in earlier years of AIDS. The third way transmissions from AIDS is mother to infant. Sadly, most children with HIV contracted it from their infected mothers during pregnancy or childbirth. If the woman is infected, her child has a 50-50 chance of being born with the disease. Once, or if the virus is contracted through these ways, the symptoms of the HIV infection may not appear for a long time after the person gets infected. Initial symptoms of HIV infection are usually not apparent because they can be mild. However, as the virus progresses, the immune system begins to become weaker, and a person may experience swollen glands, painful ulcers, migraines, rashes, and muscle and joint pain when first infected. After a few years, other symptoms including diarrhea, weight loss, and increased number of infections may occur. In conclusion, everyone is at risk of becoming HIV and AIDS infected. For that reason, it is important to inform people on facts about this disease, because there is no reliable cure or vaccine existence. Prevention is the best way of dealing with the disease, according to Gale opposing viewpoints. It is important to get tested at least every other year and to practice safe sex and a healthy lifestyle.